I started listening to a podcast, and this lady says something about God has given you a voice. What exactly are you doing with that voice? Are you helping the community? Are you getting yourself out there? I'm like, ding, the light bulb turned on, and I said, oh my world, this is what am I going to do? So I call Latonia and say, Latonia, guess what? Thank you so much for helping me. And I am going to do a podcast, but in Spanish, 100% in Spanish, because the Latino, they need help. They need me. And I'm going to help them navigate the health system. I'm going to help them understand complex health issues in simple, clear, basic terms. And I'm going to make it very approachable where people will text me and ask me questions.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 53. Hi everyone, Umaya Richens here. Definitely be sure to subscribe, like, leave a review, share this with a friend, with your mom, with your dad, with someone who's interested in public health. Greatly appreciate you all. If you want to support me in other way, you can go to buymeacoffee.com/the PH Millennial, or there's going to be a link in the podcast show notes or on YouTube. But greatly appreciate you all. This episode is a very unique story. Someone who took 20 years off between high school and beginning their bachelor's degree, and she's been doing some awesome stuff since then, as well as we get a little bit of a love story in there, which I think is awesome, and I think it's the first time for the podcast. So I hope you all enjoy. I know there's some great information also around like networking, but a whole bunch of great information. But hope you enjoy, and you all will see me next week. Enjoy this episode. Today we're a bilingual infectious disease investigator, public health educator, health advocate, and a fellow podcaster. She did many volunteer positions before deciding to pursue her bachelor's degree, which we spoke about a little bit before the show, and she has a very unique and interesting story into her public health career, which I'm excited to tell. So she completed her bachelor's in public health with an emphasis in health education and promotion at Brigham Young University. She works as both a program surveillance specialist and COVID-19 health investigator for the Dallas County Health and Human Services. Additionally, she hosts the podcast Buenos Dias Salud, and be sure to follow on Instagram at buenos.dias.salud. We have Gabriela Calvi, BSPH. Welcome to the show.
Hi, Omari. Thank you so much for having me. I'm so excited for this opportunity.
Yeah, my pleasure. I wanted to give you some space to introduce yourself in Spanish if you would like to.
Oh, ok. Gracias. Mi nombre es Gabriela Calvi. Soy educadora bilingüe de salud pública. También soy investigadora de enfermedades infecciosas en el Departamento de Salud. Y también tengo un podcast llamado Buenos Dias Salud.
Okay, thank you. And I'm hoping that I put aside some time to get back into learning Spanish, because I feel like it's something that I should learn, at least have like a basic grasp of it. So I appreciate you all you Spanish speakers pushing me to want to do that more. So look out for me. Like, I think when I do get comfortable, I would definitely want to hop on your podcast, because I believe it's all in Spanish. So yes. Yeah, so give me a couple of years and then I'll be there.
Absolutely.
Awesome. So how are you doing, and how have you been coping during these times?
I am doing a lot better now. It's been, like we all know, hectic. It was super busy, but one of the things that I'm trying to be good at is to set boundaries and do a lot of self-care. And so I'm the type of girl that love to connect with nature. I'm be physically active. I love running, biking. Even I went biking yesterday, a 44-mile bike ride, and I crashed, but doesn't matter. I say that to be healthy, you have to pay really hard. But now both of my knees, they look the same because they have, last month I scratched my knee, and then now yesterday I have another owie in my other knee, but that's okay. So they're twins now. So yeah, that's one of the things that helped me a lot, is to be physically active where I can take care of myself and I like to read a lot. And since where I live and my work is like an hour, and good days, an hour, 10 and 15 minutes on a heavy traffic day. And so I listen to a lot of books. And so that's one of my go-to ways for taking care of myself.
Yeah, that's awesome. And have you been cycling for a long time, or is that something new that you've been doing?
I've been cycling for about 3 years. I did my first triathlon. It was quite an experience. I would do it again, but now that I work, it takes a lot of time to train. So even I did a half marathon in last November, and even training for a half marathon, it takes you a good portion of your life to train. And so training for a triathlon or even a marathon is just a lot more. So I just trying to squeeze in a little bit of time for that. But and then I start in grad school in the fall. So I don't know if I could do everything, but I try to squeeze in something.
Yeah, you definitely have to squeeze it in as you go, because life can get crazy, but you have to make sure to set aside time for those sorts of things. Well, before we continue, I just want to ask more about the triathlon. So what was that why did you want to do that? And then what was the process like, just preparing for the triathlon?
Why I want to do the triathlon? I like the girl, like, you give me a challenge, Omari, and I will take care of that. I would take you on whatever challenge you will give me. You propose something and okay, that sounds really interesting. And since everything related to physical, anything that challenged me also mentally, because not only about physically, but it mentally challenge you. And so I'm always thinking, okay, how am I going to break that barrier, whatever barrier presents to me? And so my mind is always like a machine, thinking. And I wanted to see what my body and my mental health was able to take. And so I did. And surprisingly, I broke my personal record, even though it's my first time. But when you go to a race, you always set your ideal time that you want to finish the race. And I beat that time. But the most surprising thing was that I crashed on a bike during the race and I dislocated my shoulder. And when the first aid and paramedic came, like, you cannot continue. You have your shoulder dislocated. They put it back in the socket, but I was so sore. They needed to do x-rays, and I told them, bend me up, put a bag of ice, and I finished the bike race with one hand. And then I have to jump in to do the running. The same, I told them, put more ice, bend it, and I ran with one arm just like that. Like, it was so painful, but I did it. And then I broke my personal record. So I'm impressing. Wow. My husband tells me, you're crazy.
Yeah, that's amazing though. Congratulations. That is really awesome. And like as you said earlier, it speaks to pushing your mind and your body to the limits. And I feel like if you're able to do that physically, mentally, there's so many other things in life that, okay, that's just simple. I can do that. I can put my mind and do that. So
yes, definitely. Because even challenges at work that I may have, or even in my house, like, you can relate a lot of those things, challenges that you have, especially mentally, how you face those challenges. Really
yeah,
good.
absolutely. So how do you identify, and then tell us a little bit about your personal background?
Well, I identify as a beautiful Latina girl. I was born and raised in Venezuela, in Caracas, Venezuela. That's in South America, next to Colombia and by the Atlantic Ocean. And so it's called the Caribbean Sea. And I came to United States when I was 18 years old, just graduated from high school in my country. So I came to the state. I didn't know anyone. I didn't know any English at all. So I learned all the English that I learned here during school and in college. And yeah, that was like more than 25 years ago. I've been here.
Yeah, and you wouldn't be able to tell by just looking at you that it has been 24 years. I would just put that out there first of all, but that's amazing. And that is a huge jump of faith to come here not knowing any English and getting through all of that. So what was the reason that you came here by yourself?
When I was little, I think I started when I was 7th grade. I would tell my parents that I wanted to come to the United States to learn English and to study, to better myself. For some reason, I had that feeling, when you have that feeling, that gut feeling that I don't know if I should do this, but you don't know exactly the reasons. Well, that was the same. I didn't know the reason why I shouldn't stay in my country. All I knew is that I didn't have a future over there. And this is way before, all the political, socioeconomic disaster with Chavez, way before Chavez. So I said I wanted to come to the United States and study. And I think one of the things I related to is that I wanted to experience that college life, because I will watch the shows and TV, the United States. I wonder how it feels, being in college and have my own apartment with roommates. I wanted to experience that. And so I told my parents, I want to do this. I want to study English. I want to go over there. But I didn't have the thought, it not came to me that, okay, I will go there. I am going to stay in the United States forever. My thought was, I'm going to go there and study. That's it. I didn't know that I was, going back. So I got married and I stayed.
Okay, that's awesome. Thank you for sharing that. And fun fact for anyone, so I'm from Trinidad and Tobago, one country, two islands. Trinidad is actually closer to Venezuela than it is to Tobago, which is very interesting. But yeah, that's crazy that you had. I guess I can't see if you had the foresight to leave Venezuela, because I know things are really bad there right now. There are a lot of people from Venezuela coming across illegally to Trinidad, and I know our Venezuelan population has increased a lot.
Yeah, around the world, everywhere. It's really, really bad.
Yeah,
a lot of crisis.
Yeah, so if I do see you leaving the United States, I'll probably just follow you, because you seem to know things before, like 20 years before it happens. So
I try.
Awesome. So what does public health mean to you?
Oh, this is one of my favorite questions that when people ask me, and I'm glad that you asked me, because public health means a lot to me. But there's one particular quote that I love, and it is, in order to eliminate disparities in health and achieve health equity, we need leaders who first care enough, leaders who know enough, leaders who have the courage to do enough, and leaders who will persevere until the job is done. So I think that's one of the 4 qualities that I really connect, that why I love and chose public health. I first care enough. I want to become a leader that knows enough. That's why I continue studying and continue networking, continue, talking to people and learning from my peers, from my associates from work, even from you and other podcasters and public health professionals, and leaders that have the courage to stand up and to do enough. And we have to persevere until the end. We cannot give up for the good reasons that we decided to be in public health. And we're doing public health not only because we want to earn money. Yes, sure, money is important. But for me, it's more like I am working for the community. I'm not working for my personal well-being.
Yeah, Absolutely. And I love that. And yeah, there's so much to speak about public health, because I know a lot of people feel like they're in jobs that it is meaningless, but public health, I feel there's just so much meaningfulness in the jobs and the work that you're doing to really move forward and improve communities, or work with communities to help them improve themselves, whichever perspective on health you take.
Exactly.
Yeah. And then, so before you went into, so tell me a little bit about the process for you getting in, because I know right before the podcast started, we spoke a little bit about your interesting, well, not interesting, unique journey
Yeah.
into public health, into like schooling here. So do you want to talk a little bit about that before we jump into some of the volunteer work you did before you got into your bachelor's degree?
Yes, definitely. Yeah, my experience is really unique and different from other people that you have interviewed, and because I started, I would say, my career late. And when I say late, it was almost when I was 40. When I came here to the United States, I was an exchange student, therefore I was paying my international fees. But because I got married soon, I mean, so early, I was 20 years old when I got married. And so my parents decided, I'm sorry, you already married, your husband is the one who should take care of you. And since we're newlywed, I mean, who newlywed have money, you know? We're newlywed, we're poor, like a college student is poor. So we couldn't pay my international fee, so I have to wait. And then I became a mom. So for 21 years, I dedicated my entire life to be a stay-home mom. But in the meantime, I would do community volunteer work. I would do little certification here, there. I would continue reading books. And so that's what sparkled that desire to do public health, because there was towards my end of my pregnancy, well, after I had my last child, I'd hit bottom, like really, really, like depression. I mean, I should not deny I was depressed, and I decided, well, I need to do something for me, something that I can help me, but I can help others, because if this is what I'm going through, I can imagine what others may be going through that same experience. So I decided, okay, I need to go to school, and I was looking and looking what is out there. I look at the school that I wanted to go and see what they offer. And I knew something with science. I'm a science girl, because before I was studying to be a special ed teacher. And then I found public health. I read, what is public health? And like, oh, this is exactly what I want to do, you know, community service, be an advocate for the public. And it's all about health. And, you know, I can do chronic disease or infection disease, or I can do mental health. And what exactly what I was going through. I was going through depression. I wanted to help other moms, or I thought about, you know, helping veterans that, you know, they have depression as well. And so that's how it became to public health to me. So it's never too late to study, no matter your age. I think things come to you in your life at the right moment, at the right time, when you're ready for it.
Absolutely. For everyone, it's going to be a unique journey. And I'm glad that that was your unique journey and that you're able to share it now and share where you are. And earlier you said you got into grad school, so I'll dig into that a little bit later, but that's awesome. Congratulations. I'm excited for that. So before you got into your studies here, you did some mentorship. So you were a bilingual mentor at Sacramento Food Bank and Family Services, as well as a school fundraising committee at John Adams Charter School. So tell me a little bit about your involvement in those two organizations.
Yes, while my kids were going through school, I wanted to keep myself busy, so I didn't have any kids at home, and so I joined the food bank, and so it's called the Sacramento Food Bank. And in the food bank organization, they have a particular program, which is the perinatal program, and the moms. It's almost like a week, but over there it called a little bit different, where the moms that are pregnant or they have child that are less than 5 years old, they can come to this building and they can grab some food supplies, they can get some clothing, some diaper. And so I was the person who help them get the supplies that they need. I will connect them with community resources. If they didn't know English, but they wanted to, learn English, I will connect them with the community college or free English classes that they have around the community. So that was my role. And also to organize the stock, the pantry, and make everything organized and stock everything that it will come to our building.
Okay. And then for the school fundraising committee, what do you have to do in that?
So on that one, it was my children's school. And so I enrolled to be a volunteer, like a PTA parent. And so in there they do a lot of fundraising. It was a charter school. And one of them, my role was to be the person in charge of going in the community and ask for sponsorship. Help us get some sponsorship for X fundraiser that we wanted to, and promote the fundraiser throughout our community and also within a school. So that was my role, going through store to store or writing letters or calling like Target, the manager, or Walmart, or the big companies like maybe a grocery store, and collect and tell them who we are. There was a charter school, so it's a 501c, a nonprofit organization, and we're doing this fundraiser for this reason, and we're seeking sponsor for X, Y, and Z. So we will tell them, and they will say yes or no. And if they say yes, I will go to the store department and collect whatever donations that they will give. Sometimes they were monetary donations, or it was an actual product item. Like Walmart, we will get like bottles of water so we can give for free to the participants and the fundraisers, or if we were selling hot dogs, so the store Walmart will provide the food for us, but then we will sell it. And so that was a way for us. So yeah, this difference, it was a lot of work, but it was fun.
Yeah, that definitely does sound like a lot of work, having to go around to different organizations around the community. But it seems like you built up like it sounds like sales skills, and like talking to people skills, and
yeah, definitely.
Yeah, and then so after this, you became an independent contractor specialist at Digital Data Management. So to talk about that.
Yeah, it's a little bit totally different, because that was a work from home part-time job that it was in the afternoon. So I will start 6 o'clock in the evening until 8, 9 o'clock. And it's basically I will work for General Motors, GM dealership. But we were a third party. So I will have to go into the dealer database and pull out the stock inventory. And I will have to read codes and analyze the data, where I have to see what were they low in auto parts, what they need. And then I will have to go to another website, which is the factory, the warehouse, where they manufacture the auto part, and buy that part for them and restock the inventory. So it's a lot of data analysis and moving items from one software to another software, and make sure that those 2-3 databases at the same time they match.
Okay. Very interesting.
It is very interesting, and it was a fun, quiet job. It was more like a very, very independent, and it was by code of honor. You have to say, okay, I work from this hour to this hour, and I have deadlines, because each store throughout the United States have different deadlines, like Eastern time, Pacific time, Central time, Mountain time. And so you have to be very honest with the work that you do, and be very organized and punctual on your deadlines.
Okay, that makes sense. How did you learn English, saying that you came across the US not knowing English? What was that process like?
It was a lot of work. Yeah, I didn't know English. My roommate knew Spanish.
And where in the United States did you come to when you came?
From Venezuela, I went to California.
Okay.
I stayed there in California. And so my roommate knew Spanish. He would reply in English to me. And then I decided, it's right. I need to submerge myself in the American culture 100%. And the only way to do that is for me to go cold turkey and do everything in English. Watch TV, read, listen, and go to a lot of activities in English, full 100% in English, and forget about the Spanish. So that's how I learned English. And of course, going through school in English, morning, afternoon, and in the evening, everything was in English. And it was mentally exhausted, tiring. And the only time that I have to speak Spanish was when I would talk to my parents over the phone. Other than that, there was nothing. Or I would write in my journal. At that time, there was no email existed yet. And so I would write also letters. And I would love to, I remember when I would go to the post office and then, okay, where are you sending your letters? And Caracas, Venezuela. I'm like, what? That far away? So I would have to put a special stamp. And then the letter will take forever to get there, like a month later. But it was always fun to go to your mailbox and see, did I have any letters in there? Did I have any letters? It's great fun. But yeah, that's important. And that's what I tell everyone coming from another country, whether they speak, I don't know, Tahiti or I don't know, French, German, Spanish, if they come to whatever country, if they come to America, and then they say, wow, the Americans are too cold, they're not friendly. Like, you know what? I think you don't know them well yet. You have to put yourself out there. You have to show interest that you want to learn English. You have to show interest that you want to learn about their culture, and they will open to you. Because that was my case. The minute that I opened up myself and I wanted to be part of their culture, they took me right in. I never felt discriminated. Well, there was a few things here and there, but I mean, it wasn't bad to me where I said, yeah, I was discriminated. But you just have to open up and take with love and heart the land that is opening their doors to you.
Yeah, well, thank you for sharing that. And I could only imagine how difficult it would have been to just cut off Spanish and just do English and everything in life. That must be challenging.
It was very challenging. I remember there were nights that my pillow was my best friend. And when I say that, it's because I will cry like no other with my pillow in my mouth and my face, because I didn't want my roommates to know that I was so sad. And it was very frustrating. And then I remember the first date that I went out with a guy, and it was now my husband now. I had to go with my roommate, but I didn't know any English and he didn't know any Spanish, so she was my translator in the day.
That is awesome.
That was another story, another podcast when it goes to dating. But it was really funny to have my roommate be the translator for our date.
That is awesome. That is really awesome. Using your resources, you need to go on your date. You got a roommate. You got to fix that problem.
Yeah, and it was like a friendly date. At that time, we were not dating like a boyfriend or girlfriend, just our first date, get to know you, have fun. And then after that day, he decided, you know what, I speak Italian and Spanish is really similar. So I would speak Spanish to him, and then he would speak Italian. That's how we communicate. But we only went out three times, and then he said, forget it, this is not working. And then we met again. It's turning into a dating podcast. But just to tell you that, then a year later, we met again for some weird reason. And then he listened to me speak English, and I was talking. He's like, wow, your English got really well. So what really interesting on me. And that's when we start instead dating because I knew English.
Okay. So that all paid off. That all
It
paid
paid off.
off.
Exactly.
Awesome to hear. Awesome to hear. So then after the independent contractor specialist job, you became, well, I think you also did that throughout your time with a lot of other jobs, but
Mhm.
you were associates in general studies at Brigham Young University. So what was the thought process for this?
So when I first went back to school after being 20 years out of high school, I I knew that I was public health. But then by talking to my counselor, advisor, she said, well, you know what? You're being in school, you almost getting your bachelor, and you're really close completing this associate. No, what was it that she said? I'm sorry. Hold on, let's start. Oh yeah, I remember now. Okay, sorry. Let's come. Okay, so I was talking to my counselor, and being that I've been out of school for so long and now coming back, and I think by my second year into my bachelor, I expressed my counselor a little worry about, I'm a mom of 4 kids. You never know what's going to happen. Maybe some circumstances happen and I have to pause school for whatever reason, but I don't want to do that. But I want to have something under my belt. And I want to have some type of certificate, some type of diploma. I start throwing things out at her. And she said, you know what? Looking at your credits, I know that you're getting your bachelor, but you already completed all your core courses, classes, and you can have your associate. I mean, you don't even have to apply. You already did it. All you have to do is talk to administration and say that you want to get your associate so they can, process that. But you don't have to do anything special because you already completed all those. And so that's I did. So I went to administrations and I submitted the form that I wanted to have my associate because I already have all the credits, and they look. And so I wanted to have something under my belt because I was afraid that if something happened, I didn't have any type of education. I know that with associate, I cannot do very much, but at least I have something. And it was like a stepping stone, milestone that I wanted to kind of check off, and okay, I've achieved it, I completed it. And so that's how it happened.
Yeah, and absolutely considering that that just things, life can happen, and you just wanted to have that something to step up from next time you do anything.
Yeah.
So what was the process like for getting your bachelor's? Was it like just a fluent process from the associates, or did you actually have to stop?
It was full. I continue. Yeah, luckily I was so blessed. I continue without problem. I did my bachelor with 3 years. I did it really, really fast, or less than 3 years. Full time. There were semesters that I took 16 credits one semester. Some students, they take the one semester off, especially summer. I didn't. I was one of those crazy students that would take those hard classes like biostatistic classes, epi classes are really hard. I took it in the fall because I just wanted to. My logic was, okay, if I'm going to suffer with a hard class, I'd rather suffer for 7 weeks instead of 14 weeks. And so I would take those hard classes during the summer. And then my husband was really supportive for 2 years, go on vacation alone with the kids while I would stay home, because every time that we planned a vacation was during those final weeks, like, the last 3 weeks of the semester was really hectic and needed to study. And so he went along to those many vacations without me.
Okay.
And the kids.
Yeah, well, that's good that you have a supportive partner that was able to help you out throughout this part of your journey as well. When throughout your associate's bachelor's degree did you decide on a bachelor's of public health?
At the beginning, I enrolled myself in school, back to school. So that was in 2016, fall 2016. I went to school. So I knew
Okay,
that I wanted to be in public health.
okay, and you had an emphasis in health education and promotion. So why you choose those two on that?
Yeah, it was the only option that I have. The school did not provide any other options. And I looked, it was a emphasis in health education. And I'm like, oh, that makes sense, because it's something that I really can use if I want to be connected with the community. I want to voice myself and be the advocate. Health education was the perfect fit for me.
Okay, awesome. Were there any other takeaways that you wanted to share during your associate's and bachelor's degree with us?
Takeaway. I would say just take advantage of those tutors that the school offers, because I know for some students, some classes might be more challenging than other. And for me, the only way I was able to get through those hard classes, it was meeting with my peers, finding a good study group, and going to tutoring. Even though tutoring, no, I don't need tutoring. Sometimes we need to be vulnerable and not be afraid to ask for questions and think I can do it all myself, because it is impossible. I mean, I couldn't graduate if I did not have the support of my peers, my family, my children, and my professors. They were a huge part, throughout my studying process.
Yeah. That's a great takeaway, and I think it also speaks highly to you getting this degree, and your children seeing you work hard to get this degree as well. That probably speaks enormous tons to them and how they are going to continue to grow up.
That's true. Now that I remember, I was chosen, I don't know how you call it, I was given the honor to give the commencement speech during my graduation. And I remember that when they called me, it was like a month, 2 months before school, the semester was about to end. And the dean of the faculty called me and asking me, first congratulating me, gonna graduating in just short than 2 months, and giving me the invitation that I was chosen to give the commencement speech. And I was like, are you kidding me, right? This is not true. And he said, yes. And I said, well, why? How come? What are the qualifications? I mean, I don't even know you. You don't even know me, because I did all my bachelor online. It's not like I was physically on campus. I was 100% online. And the dean said that they do, I guess they do some, grades are a huge part of that. I have a really good GPA, 3.9A, and so grades is a huge part. But then they have a survey through all my professors, and so they ask the professors, they go through like a little interview and ask the professors, what student has stand out to you in your class? And so each professor, so there were more than 5 professors that I had that they all said Gabriela Calvi. I was like, what? Are you kidding me? This is amazing. This is awesome. Who would think? Because I was the type of girl that I was constantly meeting not only with my peers, but I was meeting with my professor constantly. If your professor says, please let me know if you have any questions, and I'm here for you to help you out, I took them on that. You said that you're here for me. And I say, I am here, I'm doing all of this, but this is not making sense to me. I'm doing this, but I'm stuck over here. Please, I need help. I will show all the proof, all my work that I did. I never show up like, I don't know how to do this. Please help me out or do it for you. No, I will I would meet with my professor and I would show them, this is what I did, A, B, C, D, E, F, G. I'm stuck over here. If this is right, this is not right, please help me out. And so I was constantly with him. I remember in one class, it was anatomy physiology. I would meet with my tutor 4 times a week and then twice a week with my professor, because it was such a hard class for me. And doing it online, it is even harder. It's totally different being a student on campus than being online, because online you basically are teaching yourself. And so I have to do extra work. And so if an assignment, the assignment, I remember the professor who said, okay, the assignment takes you 2 to 3 hours. I mentally told myself, okay, this is for American people. I am American because I'm naturalized, but like born and raised in America. Okay, for them it's 2 to 4 hours. And so I will mentally say, okay, for me, to Gabriela Calvi, it will take them double or triple the time. And so I will have to schedule myself really carefully with my studies, and I barely have any social life. But anyway, so that a special moment where they told me that I have to give the commencement speech for graduation, it was pretty awesome. I still get tears every time I watch the video, and reminds me the reasons I did it, and giving all the kudos to everyone else too, because I couldn't done it without them.
Yeah, that's awesome. Is that video available on like YouTube or something like that?
So YouTube and I'm on Facebook.
Okay, definitely share that with me and I'll put it in the show notes for anyone that wants to check that out. But that is awesome. But I want to say that I want to make sure we don't miss some things that you said there. Like, firstly, you were open and receptive to the help that the professors were willing to give, and you took them up on their offers. And then that because a lot of students don't do that, firstly. So just doing that puts you ahead of a lot of people in building relationships with those professors and showing that you're actually trying to do this work. And you actually said, like, okay, I did this part, but this is the part that's like messing me up, or I can't get past there. So you actually put in effort beforehand and then came to them. So it's not like you're just coming to them like, okay, you do this for me and I'll figure it out. So there's that there. And then you also said that you were very like self-aware of what you like in what you just said. Like, it will take someone, a regular American, 2 to 3 hours to do the work, which you knew that it's going to take you 3 times that time. And being self-aware and recognizing these things from beforehand is so important in just our personal growth and understanding. So I think
yes, you have to really know your learning styles. Some people are visual, audio, kinetics, and the touch. I would tell my professors, I'm a visual person. I cannot just read a book and trying to interpret your guide, your PowerPoint. I need to talk face to face, and you need to draw as you speak to me, because I just can't comprehend just reading 100% the whole time a book, because I don't process that way. So it is important for a student to recognize their learning technique. That way you can let your professor know how you learn best.
Yeah, absolutely. And then your next role was a health educator, facilitator intern at Hope's Door New Beginning Center. So how do you get this internship?
That was my second internship after I graduated. So for graduation, I needed to do one internship to graduate. So I did it. And then I was looking for a job. And it takes, some people might take so long to get a job after graduation. And I say, okay, I'm not going to do anything, just stand there and wait for the job to come to me. I need to do something. So I did a lot of networking in LinkedIn, and I connected with someone. And so it was this domestic violence, human trafficking organization, nonprofit organization. I connected with this lady, Sheila Camacho, and I worked with her going through the high school in the DFW Metroplex, like Dallas, Fort Worth metro area. And we go to the high schools and teach the teenagers anything related to healthy relationship, sex texting, human trafficking, the red flags of abuse, and we will have discussions with the teenagers and give them, it's like community outreach, give them the resources that are available to them for free. And if they're not the one who need it, we will tell them, maybe your friend, maybe your neighbor, maybe your grandma, your mom, I don't know, your dad, because men's also are abused less than women's, but they still are out there. And so just listen, take this information with you, because you never know who you run into, and maybe you can connect this person to this resource that is available in the community, because not a lot of people know that there's a lot of great community resources regarding domestic violence and human trafficking and all the stuff. So that did I did that for 3 months.
Okay, and that's awesome that you reached out on LinkedIn and you're putting in that work and being proactive to get those kind of positions, as you said, because it is tough, especially coming out from, I feel like, a bachelor's degree, and especially now it's getting a lot more competitive in the public health field. So that's great that you're doing that, and I hope that other people take that advice to do that as well.
My professor, I remember my last semester, I took the class Global Health, and the first thing that my professor in his class, when he was introducing himself, he said, one thing I want you to, one thing that I want you to get out of this class is network, and do as many internships. I'm like, many internships? So he shared his experience. I'm like, wow, this is amazing. So I took his word. He said, do as many internships as you can. Don't think with just one internship you're going to do is going to be good for you. For some people, yeah, they might be lucky, but other people's, like for me, one internship, it wasn't enough. So I did 3.
Yeah, and that also helps you with building out your network, building out different skill sets, knowing what you like, knowing what you don't like. So that is a great advice.
Exactly.
Yeah, absolutely. So you are, after this, you were a public health educator intern for the Denton County Public Health Department. So how did you get this internship?
Like, it's networking. LinkedIn. I connected with the senior public health planner, and she posted, Denton was one of my number 1 agencies that I wanted to work with, but I wasn't able to get an actual job. And it's okay, if I'm going to get a job in the public health, especially in a health department, I need to get at least an intern, something experience, get my name out of there and see what it's like. So I finally connected with Alex, is her name, and she was posting, she opened a program for interns. And I told her, well, I already graduated, but I'm still, I would like to do an internship. And so she accepted me. I have to go through the interview process to see if I qualify. They wanted to see what were my goals, if my vision aligned with theirs, and I did. So my role in there for 4 months was to create a program for a specific population, the Spanish community, because one of the epidemiologists found a particular zip code where they saw a prevalence of cases with cervical cancer. And so they wanted to find out what is happening in this community. So I used the model of the health belief behavior model. And I took the model, that theory, and I developed an educational program for the Hispanics community. And then we will bring the ladies, and then I will walk them, what does a health program, a women's wellness program looks like, because one of the things that we find out was they have cervical cancer because some of them never went to a doctor, got their women's wellness checkup. Some didn't know what a pap smear was. Getting the HPV vaccine, none of them have their first mammogram. And we're talking women's 40 and up. And so I created this program, this beautiful PowerPoint. I still have a copy of that. And I will give the presentation. What does that woman's wellness program looks like? When you go to the office, I give them step by step. Okay, when you get to the office, the doctor's office, this is what they're going to do. I show them the difference between cervical, the pap smear, and the pelvis exam, which is two different things, but they get confused. And in there, that's where I learned about more, I should say, I knew, but more the importance of health literacy. Because in the community, Latino community, I find out that not all of them have the same educational level. And because of English, there is a barrier. And so we need to speak at their level, really simple, because some doctors, they like to talk with very high language, all those jargons. And I said, this has to change. There have to be someone that can help them kind of minimize the language, but make it very simple, easy to understand, and make them more approachable so they're not afraid to ask questions. And then on that program, I showed them how to look for a doctor, what questions to ask. If you don't like a doctor, how you can find someone else. When you go to an office, what are the things that you should be looking at? If it's clean, is it inviting? Do they provide flyers, information in other language, or they're just solely in English? Do they provide translators? And all those little things. It was a great experience for me to be there.
Yeah, awesome. It definitely sounds like you did a lot of health education and navigation of the system. And we all know, like, even for English speakers, even for myself, an educated person, the health system is very hard to navigate. We thank you for all that hard work that you did. And that's awesome, once again, that you reached out and built from your network to get this internship, even though you graduated and you didn't think you'd be able to get the internship. I think just putting yourself in the position to talk to the person and have that conversation definitely helped.
Exactly.
Yeah. And then after this, you were program surveillance specialist for perinatal hepatitis B prevention program at Dallas County Health and Human Services. So how do you get this job?
I got the job thanks to two things: the internship I did in Denton, and I got the job networking through my public health alumni Facebook page through school. One of the girls that I replaced was moving, and so she posted on the alumni webpage. And I said, oh, I am interested. And so she called me in, okay, I want you to come this day, this time for an interview. And when I presented an interview, they look at my resume, and my boss liked that I did an internship in Denton County, because Dallas County and Denton County, they work hand in hand in a lot of things. And so my boss is the chief epidemiology, and then she knew the other chief epidemiologist that I work alone with in Denton. And so that really, those two things really helped me, because I did the internship in Denton County and networking through my alma mater alumni webpage.
Okay, and yeah, as I feel like the alumni pages are something that people underutilize a lot, because I know for even UF Facebook page, they post a lot of different job opportunities there, and I do believe that they would post them there earlier than some other places, or they will give you heads up. So that's definitely a place to check it out. And it's great that you reached out for that Denton public health internship, because it helped you open up new doors and show that you had experience, and you worked with a department that they were familiar with, and that worked out for you. So what did you do in this position?
The one in Dallas?
Yeah.
When I first started, perinatal surveillance specialist. So basically what it is in our communicable disease department, we have a little program with I have to kind of hunt and look for the moms that are childbearing age to see if they're pregnant. And so there's a database where if they go to a doctor, if they are tested positive for hepatitis B surface antigen, if they're in the childbearing age, I have to contact their provider and find out if they're pregnant. And if they are pregnant, I have to collect their estimate delivery day, what hospital, and then I have to look at the lab report and read the markers. If it was acute hepatitis B or a chronic, if they have a previous history. If they did not have any previous history, and then we have to send a letter and hope for the patient to call us, and then we would do the educate them about hepatitis B. And you think that some doctors will do the education program, but they don't, because when we talk to the patients, say, do you know that you have this? Some say, yeah, but I don't know, or no, I don't, or I don't understand. So I have to do the education program. If they are pregnant, and then I have to enroll them in the perinatal hepatitis program. So basically what it entails is that the state mandate us to enroll the moms and share with them that they have Hep B, what is Hep B, and then it is very contagious. Now that you're pregnant, you're gonna, give birth to a child, you can pass it to your child. And so it kind of makes them aware that the moms, after they give birth to their child, they need to right away enroll their baby with a pediatrician, so the pediatrician can give all the necessary vaccines for 4 months. And so every month I go into this database again and follow up with the mom or the pediatrician to make sure that the child is receiving their vaccine. So moms are late for X, Y, and Z. I mean, it's normal, life happens. So I have to constantly monitor that and encourage the mom to go, or even the nurses to call the moms to remind the mom that the child is overdue for their well checkup visit and be current to their vaccine. And so after the fourth dose, that's between 6 to 12 months, when the baby is 6 to 12 months, and then we have to do a PPV, which is a blood test to make sure that the child is immune against Hep B. And then once the child get their final exam, and then we kind of congratulate them, we're move them out of the program because they are no longer Hep B. So it's very interesting.
Yeah, it is fascinating. That is a lot of a lot of good work, but it's definitely difficult to be having to track down people. And then it goes back to the health system in general sense, that there aren't things like naturally in place to give mothers, patients that sort of information and give them a place to educate themselves and ask the questions. But we do that afterwards and have to like kind of follow them around after the fact to try to get this information. So it speaks to the poor setup of the health system, but it is really important that we have these types of rules to really get those people that might know, they mightn't have that kind of education or any knowledge about these issues, or might even know what it means to have hepatitis B.
Exactly. Exactly.
So that's some really important work there, and I'm guessing this is the case for a lot of other diseases that occur out there.
Oh yeah, all of them. Now I'm not only doing Hep B, I'm doing other disease. And like on Thursday, on Friday, why are you calling me? And how you got my number? So I have to tell them, because a lot of people don't know what's the role of the county health department. And so I have to tell them, by law in the state of Texas, medical providers, whether an urgent care, a private physician, or a hospital, if they do any type of test and it's a communicable, reportable disease to the state, by law, they have to report it to the State Department. The State Department the health department have to do a follow-up, because and then we as a local health department, we have to report it to the state, and then the state reported to CDC. So that's how it works. So a lot of people don't understand that, how it works. So.
Yeah, thank you for sharing that. And then you are also, I believe, a COVID-19 school health educator at Dallas County Health and Human Services. So how do you get this other role, or did it just like integrate with your other role as a program surveillance specialist?
Right. So my health department is big, but at the same, my division is small, and so I work under the acute communicable disease department, epidemiology division. So that division, we are really small as far as manpower, people that work there, but we cover a lot of communicable, reportable disease. And in the health department, I learned, and all my associates can speak to that, we have to multitask. One day you might be doing one responsibility, but the next day or the next month, your role switch. So you have to do multiple assignments. So that's how COVID came. So I started my job last year, January 2020. COVID came. I started listening like the first couple cases, February 2020, right? Well, December, but like in Texas. But then our first case in Dallas was March 2020. And so my role switched. Everyone, all the EPIs, all the nurses, they stopped doing all the other disease, and we all concentrated in COVID-19. And there's only 2 people in my department that speak English. It's me and another coworker. And because I knew Spanish, I was taking all the Spanish cold. I was doing all the contact tracing, the first couple cases that we will get in the health department. That was back in February, in March of last year. So that's how I got there.
Yeah, and that makes sense. And that's awesome that you all were able to pivot and take on COVID-19 as it came out the gates, and seemed like you all were there as early as possible to really stop and prevent as much bad that could have happened.
Right.
So, yeah. So what exactly did you do in this role?
Contact tracing at first, and then cases start coming crazy. It was like more than 100, and we didn't have enough people, and we decided, okay, we need to look for the medical students to come and help us, because that was. And so my associate and myself, we created a little program, training orientation, and we trained more than 200 medical students, and they needed to be anywhere from the 3rd, 4th year of medical school to work part-time for our department as temporary. And so we would train for a month, 2 months, the medical students, and then I continued doing the contact tracing investigations. And then I did a little bit of all those cases, interviews that we did. I have to report it to the state. And so there's a special database that you have to report, all data analysis. That's my least favorite part of, to be honest, of public health. I don't like data, but it's a huge part of public health, and I struggle with that all the time. But just reporting data. So I did that to the state because it was very important to them.
Okay, awesome. Thank you for sharing that. Thank you for the work that you did, and that's awesome that you all pivoted and got help from those medical students to really fill in that gap. That was, because 100 calls a day, that's a lot of calls. That's a lot of calls.
Right.
And I can only guess you got more calls than that later down the line. So that's awesome that you're all able to do that. So apart from these 2 roles that you currently work, you are also a freelance columnist at Conversación, Florida. Did I say that correctly?
Yes.
Okay, I'm getting a little better with my Spanish, everyone. And,
Yes.
so talk about this freelance columnist role that you do.
Yes, and that started October 2020. I participated in a networking event again. I love networking. I love attending to whatever webinars and all this stuff. So I was networking, and they asked me who am I? Present yourself. I told them what I do and that I have a podcast. And I said, wow, this is amazing. I'm looking for someone to write articles for the newspaper in Spanish each month. Would you be interested? And I said, oh, let me think about it. So went home, I slept, and I'm thinking, and I don't know if that happens to you, but then you start doubting about yourself, your ability to perform something. I'm like, ay, Dios mío, I would say in Spanish, should I do it? Should I do it? Well, anyway, I called him up and I said, okay, I'm going to give it a try. I told him, the only way to know if I'm good at it is by practicing. If I don't practice and put myself out there, I am never going to learn. And so I did. So I've been doing it for a couple months now, and it's been great. I like it.
Okay, and how do you go about developing the stories that you write about?
Lately I've been connecting them with the topic of my podcast. So I try to be, that all my platforms are they connect with each other. But at the beginning, I just thought about what is it that the public needs? What are those questions? What are those concerns? So that's why I'm always online searching. I'm in different networking events and different, I'm in a huge Latina bloggers, entrepreneurs WhatsApp group. It's more than 300 ladies with different backgrounds. And I'm always reading and some listening because some leave audio. And they always have questions about any topics, and they network between them, and they give advice between them about social media and all the stuff. And so that's one of the way I know the needs that the community, reading online and looking. Also helps me know how to do what type of topic I should talk, is because my work at the health department, I talk a lot to the Latinos. And so listening to the stories, because you will be very surprised that you are doing an interview with this mom or gentleman, and because the way I approach the patient is really approachable. I don't put myself, well, I'm a health authority and you're the patient, and no, I don't. I'm really approachable, really friendly, and I show genuine desire to help them, and so they open up. And so you will be surprised that by doing that, they start opening up, and so they tell you a little bit more than what you should know. And so the little story start getting alone, and start someone in the phone and listening to them. Oh yes, sí señor, sí señora. Through the conversation, I learned, oh, okay, this person needs a little bit more help understanding of this topic, because if she has this issue, I'm sure others people have the same issue. So I start connecting my content and my information that I want to share with the community.
Yeah, that's a really smart way to get feelers of like what people are not understanding, and just giving them the information around those topics. So that's great. And how like you are very big on networking. What got you so interested in networking? Was it that initial professor that said that you need like networks, or what got you and keeps you interested in building a network?
Yes, my professor was the number one, and then I talked to someone at my church, and he's a veteran and really good about networking. And he also told me network. I'm like, okay, I'm going to put myself networking. Here in Northern Texas, they have a huge networking event every Thursday in the morning. This is way before my internships and all the stuff. I'm just about to graduate. And so I attended to those network events and some called job fairs. And I learned from them, from their mini classes, how to network in person. And from them, I learned to do informational interviews. So by doing the informational interview, it helped me also connect with a lot of people and through the internship.
Okay, yeah, that makes a lot of sense. And then you also have a FEMA certification in developing and managing volunteers, which I thought was interesting. I think it's something that's a skill that people typically don't have, or maybe they should cultivate. So why do you want to get this, and what did you learn from it?
My job required it to be honest. It was right when COVID started. And so they want us to prepare us, the county, to be prepared for a local or national disaster, whatever, a huge pandemic. And so they require everyone in the department to get this certificate through FEMA. So it was really good. And then at school, I don't know if I have it in there, but school, one of my classes was community health, and I was required to take another FEMA certification. And it was also, again, related to community health and outreach.
Okay, and what were some of the top things you learned from this certification?
Who to report, how the reporting, their hierarchy works. I learned that. It was really interesting. And then I learned how to develop positions for volunteers and how to manage volunteers during a national disaster.
Okay, and how does one develop job description for volunteers or positions for volunteers?
Yeah, so I learned that you just don't look for volunteers because you want to have volunteers, right? You have to create a job description, specifically what exactly you want that volunteer to do. Yeah, I need volunteers. Okay, but what you need volunteers for? And so that's what we did. When my associate Michelle and myself created the training program orientation for the medical students. We said, okay, we need help. Just 4 or 5 EPIs that our department has, is not enough for all those 500 plus cases that will come just in one day. It is impossible at the beginning of the pandemic. We need volunteers. We need help. And so, okay, we need help. What are we going to do? So we created a orientation. We walked them through what is contact tracing, what are the questions, how to ask. And we created, okay, these are the hours you're going to work. This is what you're going to do. And then we walked them through the responsibilities and how to do their job. And then if they couldn't get someone in the phone, you made 3 attempts, but those 3 attempts do not means on the same day, have to be 3 different days, no one call after another one. And if they don't answer, and then we send them a letter, and then the letter needs to have their patient ID number and like a medical record and stuff. So that's one of the very important things, that when you seek for volunteers, you need to create a job description for them and let them know who they need to report to.
yeah. Okay, that's great information. Thank you for that. You're also a policy and advocacy committee chair at the Texas Public Health Association. So how did you get this and why?
Yes, in school, my professors also encourage us to join any organization, public health organizations, like APHA or SOFI. And so I did all of them. And I'd say, well, I'm sure there has to be something in Texas. I mean, I live in Texas. I need to help my people in Texas. And I found one, is the Texas Public Health Organization. And in there, they were looking for volunteers to be a board member to develop, what was it? Is it there? I forgot. Resolutions. Okay, to write resolutions. And say, well, I know a little bit of health policy. I like health advocacy, but I want to learn a little bit more. Yeah, challenge. And so I met with doctors, professors, people, I mean, super high. I was the only recent graduate, didn't know anything. I told them, to be honest, I told them, I don't know very much. I want to learn how health policy works, but I'm here to help and to be any, and I said, no problem. You learn just, so I attend their meetings every month. And when it comes to the time where, okay, I need people to take a responsibility for each of the statements that they want to write, resolutions, because then these resolutions, we will send it to the state so they can pass a law, a bill. And so I chose human trafficking and domestic violence, because that's one of the needs that they saw that Texas has, one of the problems. And I chose that because I already did my internship with Hope's Door New Beginning Center. And so I knew a lot about human trafficking. And so that will help me. So I learned to write resolutions and then to post it to the state to pass the bill.
That's awesome, man. I'm glad that you went out and took the chance. As you said, like you were the only recent graduate there.
Yes. Very small.
Yeah, I can imagine like imposter syndrome kicking in and you're like feeling like, oh, do I actually belong here? So, but you do. So I'm glad that you put yourself in this space to do that and you learned from it as well. Okay, so lastly here, we have Buenos Dias Salud podcast. So tell me about the podcast. When did you start it and why did you start it?
Yes, I started October 2019. Okay. And I was desperate. I graduated April 2019. I did all those 3 internships and I still did not have a job. And well, I have my first interview with Dallas County like in beginning of October September, October. But I told them that I was going out of the country because my husband gave me a graduation trip. And they said, well, that's fine. We can wait for you until you come back. And since the county, it's a government agency, they take forever for someone to start. I'm like, okay, fine, no problem. So in that waiting, I didn't know if the job was going to be materialized, yes or no, because until you don't have the letter in front of you, yes, the job offer, the letter offer, it's like, I didn't want to take that word 100%. I wanted to have the job offer, the letter in my hands. So I was talking to a great mentor that I met her through LinkedIn. And I think you know her because you have interviewed her before, Latonia. Mm-hmm. Okay. And I was talking to her. She's one of my great mentors. And she said, Gabriela, you know what? You speak Spanish. You have done a lot of great work. You work at the Denton County. You created a health program for the Latino community. And what exactly are you doing? You speak Spanish. You in public health, you need to help the Latino community. So take advantage of that. And then minutes after her conversation, I started listening to a podcast, and this lady says something about God has given you a voice. What exactly are you doing with that voice? Are you helping the community? You are getting yourself up there? I'm like, ding, the light bulb turned on. And I said, oh my world, this is what am I going to do? So I called Latonia I said, Latonia, guess what? Thank you so much for helping me. And I am going to do a podcast, but in Spanish, 100% in Spanish, because the Latino, they need help. They need me. And I'm going to help them help navigate the health system. I'm going to help them understand complex health issues in simple, clear, basic terms. And I'm going to make it very approachable where people will text me and ask me questions and ask me for help to connect. In reality, I get text messages through my WhatsApp. Gabriela, I have a question. Sorry to bother you. Can you please help me with this and this? I connect them. I tell them what to do. I mean, you name it. I became close to my community here in Texas. So that's why Buenos Dias Salud.
Yeah, that's awesome. I'm glad that you were inspired to start it, and I think that it is needed, and you need to step out of your comfort zone sometimes, or sometimes you just need that push. And I'm glad that Latonia has pushed you or helped you to guide you onto the path to start the podcast and make it Spanish and create that platform for people to get educated on these necessary issues.
It was really hard because even though Spanish is my first language, it's not like I speak Spanish at home. I don't. None of my kids speak Spanish. My husband speaks Spanish, but he doesn't like to speak Spanish. He said, I'm at home. This is my home. I'm an American. I speak English. I don't need to speak Spanish if I don't need to speak Spanish. And so I speak English 100% throughout the day. So it was hard. It's just I learned all the concepts of public health in English. And then in my mind, I have to translate it into Spanish, all the knowledge that I learned in English. I'm like, okay, how do you say this word in Spanish? Okay, but I know that this word might be right, but in the public health language, it doesn't sound right. So I was like, go search, look. Luckily, my uncle has a master in public health. He's an epidemiology and an internal medicine doctor. So I'm constantly testing him. Tío, uncle, how you say this in Spanish? And he knows English, but he's in Venezuela. But so it's good to have that support back, that family support in the medical field that they can help me and with this. But it was really hard.
Okay, yeah,
and still is, but good.
I can imagine. So you said something along the lines of you created the column articles to align with the same health topic that you talk about on your podcast. So how do you decide on the health topics for your podcast? Is that just through communication with what's going on, or from talking to people, or is that from what? Yeah, you tell me.
Yeah, it's through what I see, like talking to people, in the news that I watch. So I go through the public health websites. I search also reliable resources. Like one of my favorites right now is CDRAP. Is the Minnesota Infectious Disease webpage. CIDRAP, CIDRAP.
Okay.
It is amazing resource, and there are other page that I didn't know before school. I just learned them through work, because it's all infectious disease that we do, that I have learned. All the medical association webpage, the toxicology webpage, also like those medical boards, and they do a lot of webinars. So I get my topics from there, because the things that they are showing is the things that they see there is a need in the community, and it's like, wow, that's true, that there is a need in the community on these topics. And so I check a lot of websites. I have good resources, so whatever they're posting, so I'm like, oh, this sounds interesting, I'm gonna like it. And so right now, May through July, August, my topics are related to enterics, which is the gastrointestinal disease, because this is that's one of my new roles in the department. I am investigating the gastrointestinal disease, so we call it enterics. And so my podcasts this month and next month are going to be related to those, because in the summer we see a lot of those Campylobacter, Cyclospora, we see a lot of Shigella, we see a lot of crypto disease, and so I'm going to be doing those now.
Okay. And I think it's important, like the podcast in itself has forced you to continue to learn, continue to stay updated with what's going on with health information, as well as staying connected to what the community is going through, and relating that information, that the concerns that people are bringing to you, and related information that can help them. And I think that's important, regardless of if you're doing a podcast, if you're just in your career. It's so good to push yourself into these new spaces to make sure that you're learning new things. And I think sharing those new things to other people is so informative, not only for them, but it solidifies it for yourself as well. So that's awesome that you're doing this type of work. How do you stay consistent with your podcast? Because I know it is a challenge for myself to do this and then do everything else in life as well.
Yeah. Last April, because of the pandemic, I will work 13, 15 hours a day. And it was just crazy working, from March all the way to November, all those hours. And I said, okay, that's it. I need to set more limits, and not working that many hours anymore. But it was really hard. So last April, I decided, I can't do the podcast by myself anymore, because I was doing the investigations, the recording, networking, and finding people to interview, the production and the editing and yada yada, all the stuff. And so I said, forget it. I'm going to hire someone. So I hire someone to edit my audio, and then I hire someone to do all the posts on Instagram. So like I will tell them, they know the topic, I tell them what exactly I want, but they are the masters who put them with the specific words, the specific hashtags, and I start connecting. Because that's another thing. Not only I need to learn about podcasts, but then I need to learn about digital marketing. I did not go to school about digital marketing. So now I know this much than before. I knew zero, but now I knew a little bit more. But that's very time consuming. So I just couldn't. So I told my team here. So we have a calendar. I recommended Trello. I think that's how you pronounce it, Trello. And I laid out the topics. I tell them who I'm interviewing, or if I am a solo interviewer like me, and I give them the contact information on the person I'm interviewing, so they can check out their social media, so that way they get to know that person they're going to interview. That way they can create like a biography about this person on the post. And I tell them the topic, and so they start thinking about the design. Sometimes I tell them, well, I want the design to have this or that, and so they put it together. But I just couldn't do it all myself, so I hire a team. I'm not making any money on the podcast. Hopefully, one day, someday, I will make a little bit of money, just the money to help me continue producing. I'm not thinking about will make money just to leave it in my pocket, but mainly just to help produce the podcast. And so I can pay the people that to help me, because I couldn't do it by myself. But I did it for 4 months by myself, and I was going nuts.
Yeah, I could only imagine. And I've been listening to a couple of people interviews lately, and they've been saying like who, not how. So we so much get ingrained in trying to do it by ourselves. How can we do this? But you should really find who can do this and outsource it to help you. And that's something that I'm also doing now. I got my brother to start editing my episodes for me because that saves a lot of time.
Right.
But I wanted to ask you, like, what was that process like for you, looking for the editor as well as the person that makes your social media posts? And they're two different people, I'm guessing.
Two different people, and I guess I'm so blessed. Those two different people, both of them are in Venezuela. And I wanted to have someone, if I wanted to give someone that job, it was someone that it will care about my project, it will care about the mission of my project, that they will learn from my project, and that they really needed the money. Okay, and so in Venezuela, a lot of people are struggling. Okay, their minimum wage is $1. With $1, cannot even buy a dozen of eggs. I mean, people are starving. So I say, okay, I'm going to get someone from there that they really need it. And these two people are people that I know from my youth. I know them since I was 12 years old. I reconnected with them, and one of them, he likes, and this is not their profession. This is something that they do behind like a project, especially Raul, he's the one who edit my audios. He does it for fun, so he's really good. And he edit those. Then the people that does my digital marketing, they're a couple, husband and wife. So I know the wife since I was 12, and they are professional. That's their job. They went to school for that. And they have 4 kids. So in there, you see the great need that they need to have another extra income. And so that's one of the 3 characteristics that I looked, that they knew that they really needed it, and that they care about my project, and that they can learn, because then as they're listening and editing, they are learning. And so they're asking me questions, and then they're the one also, hey, Gabriela, I think you should talk about this. And so they're the one also helping me. I'm like, you know what, you're right. I remember so-and-so one time asked me a question about this topic. Okay, let me retake that topic and work on it. And they're the one encouraging me to be more active in the social media as far as doing live, because I'm afraid to be in front of camera. I can be camera off, microphone, no problem. But the minute you put a camera in front of me, I get so nervous. So I apologize to everyone that are listening to this podcast. I should have remembered to talk very slowly. And I'm sorry about my English. I think I have made a lot of grammar mistakes, but please excuse me. I'm not good at being in front of camera, and I get really nervous and I start making mistakes when I speak English.
No problem, no problem. We appreciate you coming on and sharing your story, and I think everyone definitely understands everything that you're saying and the meaning behind what you're saying. So we appreciate that, and that's really awesome that you're supporting people back home in Venezuela, because they definitely do need a lot of help, and hopefully government change or systems change around there can happen so that people aren't starving and struggling as much as they are in Venezuela right now. So thank you for that. That is beautiful, I think. And I just think it's so important, like as you said, like we also get caught up in like the work that we're doing, and having those other eyes and ears to say, okay, this is something else that came up that we just might have forgotten about because we're thinking about the next thing, is really awesome. And I was speaking to Dr. Huntley, who has the Epidemiology Career podcast, and the person that helps her with editing and reaching out to guests and stuff like that. She's a communications person, but she said, like, throughout just doing everything that you said your person does, they learn more about public health, and they become more interested in public health, and they're able to like have those conversations and help them with the podcast too. So that's definitely something that I am also looking into, trying to optimize myself so I can help other people do other things while I focus on continuing to do these podcasts and other things as well.
Yeah, definitely. It's like if you were super organized and scheduled yourself when you were in grad school, I think it's the same applies. That being very systematic and organized, the way you were in school, do the same with your podcast, especially if you and I, we're full-time employers. And so it's not like we're not doing anything else. I mean, we have a full-time job. And so we're doing a podcast, just something extra. And so I see podcasts for me now, it becomes like another hobby, a stress relief in a way, because it can be stressful, but I love doing it. I love studying, investigating, and looking and searching, and because I'm a continual learning. I'm a constant learner.
Yeah, and yeah, that I think it is important to continually learn and just continue building. And podcasts are fun. The editing part, not so much when you have to do all of it by yourself. But when you get to have these conversations, it is really enjoyable, and it's like something that I can definitely just sit down and do if I have to do less of the editing and the background stuff.
Oh my gosh, yeah, it was horrible.
Yeah, awesome. So at the beginning of the interview, you said that you are starting grad school in the fall. So congratulations once again. So tell me a little bit about that.
Yes. Well, to tell you the truth, right after graduation, my undergrad, I got accepted to two schools. One was George Washington. I declined that one. I did not accept the offer. And then I got accepted to Baylor University. And I accepted it, but then I deferred a semester because I thought, you know what, I should wait. I should not go into a master right after I graduated from school. And then another reason why I deferred it, because I started a new job. And so I needed to see what exactly I was getting into with my new job before I started school. So I deferred, but then I'm glad I deferred because the pandemic came. I said, there's no way I can do school with the new job and the pandemic and the podcast. I'm like, no way. So I deferred it. And then, that was 2020. December last year, 2020, I said, you know what? That's it. I'm going to grad school. No one's going to stop me. And I applied, I got accepted, and I'm starting in the fall 2021. And I'm glad that happened because I didn't know about this school. I now know about this school because of the medical students and all the volunteers that they help us through our contact tracing program, because a lot of them graduated from this school. And our health department, they do a lot of, they partner with this school and the hospital with a lot of things for the community. And so I look into the program, and wow, their master public health program and the PhD public health program, it's just amazing. And said, you know what, I'm gonna do it. So I did, and I got accepted. I'm ready to go. I'm super excited.
Yeah, as you should be, and that is exciting. And I hope. Well, I know you're gonna do great things in the program. No doubt about that.
Just adding another extra layer, just like, oh, how am I gonna do it with work and podcast? Like, oh,
no worry.
I have to do maybe once a month or twice a month podcast or something like that. We'll see.
Don't worry, it'll be like the triathlon, you fall down, but then you just bandage up and put ice on, and you just keep on going to grad school. Okay, that's awesome. Do you have a concentration that you're going to be doing?
Yes. They give me options of doing 2 concentrations. And so my number 1 is epidemiology, and the other one is community health.
Okay, awesome. What school is it?
UT Health.
Okay, UT Health. Okay.
And in fact, I have to do 2 concentrations. It's mandatory to
Interesting.
do 2 concentrations.
Okay, that's cool though, that you push you into 2 concentrations. So
That's why it's just amazing program and so many classes and options that you can take. It's just unbelievable. I just like want to take all of them, but don't give me biostatistic. I hate biostatistic. Oh, I dreaded that class and I just don't want to take it again.
Fair enough. Fair enough.
Yeah.
So before we move on to the last section of the show, wanted to ask you, where would you like to see yourself in the future?
That's a hard question. And I should have thought about that earlier. I want to see myself in the future completing my graduate program and be part of a community health program. Which one exactly? I don't know. I like prevention, chronic disease, and I like infection disease. Any of those, continue working with those.
Okay, awesome. Well, I look forward to seeing how your graduate degree unfolds and how that community health work unfolds as well.
Yeah, I'm going to ask you for your help or maybe organization, some tips on how to be a student.
Yeah, please, you have my number now. Feel free to reach out to me at any time. You can definitely chat about it. So moving on to the last section, the Furious Five questions I ask all guests. Number 1, what advice would you give to students trying to pursue a career in public health?
Can you repeat the question again?
What advice would you give to a student trying to pursue a career in public health?
Do not stress about the small stuff. And what I mean about that is that sometimes, and it happened to me, that I stress about what exactly I like. Sometimes you cannot know that right away. You have to experience that through internships, volunteer work, through networking. Do that first in order for you to find out what exactly that you want to do.
Awesome. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I'm sorry, what type of position?
Your position. And,
my position.
Yeah, and I know you have a couple of them.
Oh, yeah. What advice should I give someone that wants to get into my position? Network. And if you know Spanish, at least a little bit, start practicing right now with someone. One of my associates, she knows very little Spanish, but we talk constantly. And we talk issues about public health, like assignments. She asking me for help with an investigation, a connection with someone with a community resource. She's asking me those questions in Spanish or her best possible way. It's not 100% perfect, but I understand her idea and I'm able to correct her if she makes a little mistake. So ask someone, if you have a coworker or what's it called, a peer from school or work, or your neighbor, if you want to learn Spanish and you, hey, call me. Omar is going to share my social media, so I will be more than welcome to help out, because that's how we grow, by helping others, and also help me as well to better myself with teaching skills and stuff. So that will be one of my recommendations.
Awesome. Number 3, what's something you are working on improving in your life right now?
A lot of things. And one of the things I'm improving myself is to be in the present moment. Sometimes I worry about the future. What if? What am I going to do this? What if? It's just take one day at a time and think that no everything is because the work environment can be really stressful and we can take things too personal. We can feel hurt. I trying really hard not to take too many things personal. You just take a deep breath, and I'm learning to do meditation. I signed myself in mindfulness class, and so it's helping me to see the world differently and not thinking that everything is against me.
So that's great advice. Number 4, professionally, do you recommend anything outside of meditation?
Yes, try to, and I learned this from 2 people. Latonia, you should follow her, and Dr. Homley. Network. All the network skills that I learned was from Dr. Homley, and my friend from church helped me to learn to do informational interviews. But then there was something else I was going to say. Oh, I forgot. Oh, one of the things Latonia taught me is do as many certificates as possible by this website, train.org. And right there, you develop a lot of skills, look for things that you're interested in public health. And that's one of the things I did during that transient time between I completed my undergrad and until I got my job, my current job right now. I did several training in there, train.org.
Okay, awesome. Thank you for that. And last but not least, where can people connect with you?
Yes, I am very active in Instagram, Buenos.Dias.Salud. That's the most active, but in Facebook, they can also find me just Buenos Dias. And in LinkedIn, it's just Gabriela Calvi in LinkedIn. And in Twitter is Buenos Podcast.
Okay, awesome. Well, everyone, make sure to connect with Gabriela there. I'm happy that Gabriela came on today and was able to tell a story and share some great insights. I'm glad that we connected and you came into that Clubhouse room. I know you're in Clubhouse too. What's your Clubhouse handle?
My Clubhouse handle, good question. Let me look it up really quick. I forgot.
Yeah, no worries. But just to say that you coming on in Clubhouse room and just speaking, coming in and just speaking, I think that's important for us as public health professionals to show up in those spaces and connect outside of just like Instagram, because we get like the intimate voice connection and the conversation. Yeah, so it was nice to see you in Clubhouse the other day.
Yeah, thank you. I was surprised to see you. That was awesome. My handle is salud.podcast. And I'm trying to speak more, be more, face or voice out in the social media so people get to know me. But sometimes it's very terrifying, but I am working on. I think that's what it applies to the questions that you asked. What are you getting better at? It's just get out of your comfort zone. Get out of your comfort zone. And I have done it many times and I will continue doing that.
Yeah, you have to start being comfortable being uncomfortable, and you'll continue to grow and learn and develop yourself in many, many ways. Well, thank you so much for being on the podcast. Some housekeeping items. Thanks everyone for watching. Thank you all for supporting. Much appreciated. Make sure that you subscribe, like, leave a review, and share this with a friend. If you want to support the podcast, I did start a buy me a coffee link thing. So you can go to buymeacoffee.com/the PH Millennial, or you can just go in the description of this podcast or video on YouTube and you can support me that way. But thank you everyone. Public Health Millennial out.